I'm Natalie Kunsman, MD, and I thought today we really need to talk about pneumonia prevention and early treatment. And what does that really look like? And how do we get ourselves through cold and flu and viruses this time of year? So there are some specifics regardless of the pathogen, but the treatment of the immune system and lung optimization can be pretty universal because there's some basic tactics that we should be using to take a cold in its small phase from becoming a pneumonia. So what is a pneumonia? Pneumonia is actually an infection that gets within the lung tissue down at the alveoli. Now, some people might wonder what the difference is between pneumonia and a bronchitis. A bronchitis is literally a inflammation or an inflammatory condition of the bronchial tubes. So those are a lot bigger and the alveoli are a lot smaller. So typically pneumonia can wind up causing a lot of compromise to the system because when those alveoli are full of mucus, debris, infectious material, they cannot oxygenate or move oxygen molecules. We become hypoxic. Hypoxic is devastating to the tissue and we can get organ failure and, succumb to that illness. Again, this is why I'm bringing up this discussion today, because most things that float in the air and we contract during cold and flu season do not have to get to that point, okay? So in the first, we'll talk about prevention. So some of the prevention is how to prevent getting your infection into the bronchial tubes and then into the lungs. So that happens through our respiratory tree, starting at the nasal passage. I have been a pretty big proponent of either hypochlorous spray, which is a diluted chlorine solution. And I also have found some very good studies and very good success with iodinated sprays at being able to take pathogens at the surface and just not allowing them to get in the mucous membranes and sort of stopping things in their tracks. Of course, sometimes there is some mouth breathing and things get in that way. But those are some pretty decent tactics, whether you want to wear a mask or not and prevent entry, and whether they work or don't work is a discussion for another day. But I can tell you that stopping some particulates in the tract, in the nasal and oral mucosa, is certainly beneficial. Okay, so let's say you've gotten some of these pathogens into the bronchial tubes and to the lungs. And let's say you're symptomatic and it's time to start helping prevent a pneumonia. This will probably look like nebulizing solutions. And for those of you who don't know what a nebulizer is, I almost view it as a mist atomizer that you will put some liquid solutions in so that those solutions can become atomized that you can inhale into the bronchial tubes and get into the lung tissue. We have several kinds, and they target different aspects of the inflammatory cascade that is happening. So we have albuterol, which can open up a bronchial tube. That's obviously beneficial because if it's all full of mucus and debris and the oxygen can't get through, if you open up that bronchial tube, the oxygen the oxygenation can actually happen and some of those mucus plugs can liberate. So we have albuterol. We also have some Atrovent and some medications that can actually go in and slow down mucus production. So now we can open the tube, we can slow down mucus production, and then we have inhaled steroids. boy, are these wonderful. Now, some of the youngsters with asthma and adults with asthma may already be familiar with this because this is what helps them keep their lungs open so they can oxygenate, and they're wheezing less, they're coughing less, and they are also trying to prevent illness getting into the lung tissue. So the inhaled steroid through a nebulizer, or actually an inhaler that's handheld, will stop a lot of that inflammatory cascade of cytokines and thickening of the bronchioli and the small little capillary beds so that the mucus production will slow down. If we are also stabilizing that cascade and the release of the debris and the histamines and the heparins and the clotty cytokines, we can prevent that cascade of trouble happening in the pulmonary tree as well. So nebulizing early on is a wonderful idea. Now, for those of you who live in altitude and your oxygens are running a little on the lower side compared to some of our sea level people, adding in an oxygen concentrator to actually allow the lungs to rest is also very helpful. So you're delivering oxygen at a time when the lungs might be struggling to breathe. Of course, that inflammatory debris that we're talking about may require early antibiotics, maybe require antivirals. It also may require steroids by mouth. Systemically, we're trying to quiet down the whole cytokine inflammatory response that might be going in overdrive. There are some other things that we can do to increase what we call pulmonary toilet. That is making sure this mucus debris is released. We can use Mucinex, which actually is a mucus buster. We can use some herbal remedies such as stinging nettles and mullein and plantain leaf and some of the other loose herbals that are actually very good at helping with that. A lot of times you can do that in a tea formulation. A lot of you people have grown up with menthol and teas and honey and lemon because they also will behave as a mucolytic. The bee propolis portion of the raw honey also does a very, very good job at being anti-infective. So for those of you who are optimizing your health on a chronic, consistent daily basis, this is where your vitamin D and your vitamin C, which acts as an antihistamine, and the quercetin and melatonin, which may actually help with some of the mucus production and preventing the lungs from becoming congested with all of this mucus debris. Of course, we can monitor the situation with a little pulse oximeter gadget so we can know that if things are taking a turn for the worse. Again, notice I haven't talked about the very specific regimens that might be available per your bacteria, per your virus in this situation. Because a lot of times, if you're optimizing in such a way that I am describing, the body's going to take care of this other. And will give you some time to assess the situation or allow your immune system to get over that. This is not telling you that you don't seek medical treatment. But if you are seeking medical treatment and you are told that it needs to run its course, we can speed this process up and we can make sure that running its course does not lead to a pneumonia. Again, we just scratched the surface. A lot of what I talked about is prescriptive, and you may want to talk to your primary care provider or a functional medicine provider and make sure that you have some of these tactics at the ready in your home if you should need them. Again, I'm Natalie Kunsman, MD. Subscribe to my channel below. And until we meet again, be well.